In this video, we will cover how to e-prescribe a medication through a progress note. To e-prescribe a medication through a progress note, start by opening the patient's chart and then opening an existing note or creating a new one. Find the applicable Medications button and click on it. Then select Add Medication. Next, type the name or partial name of the medication you are looking for. Once you find it, either double-click on the medication name or highlight it and click Select. From within the Prescribe Medication dialog, enter the script instructions on the left, keeping in mind that the dose, frequency, dispense, and refill fields are required. Most of the fields are free text fields, or you can click the drop-down arrow to the right to select from a pre-configured list of options. To select a different form of this medication, click the drop-down under Root, or you can click the generic name of the medication if one exists to switch to prescribing the generic form of this medication instead. You may see different forms of this medication available when you do so. If you have additional instructions to be given to the patient, type them in the Additional SIG field or click the drop-down to select from a list of pre-configured options. This list is defined by you by clicking Edit to the right of the field. If you are prescribing a Schedule II narcotic, or if you just want to designate this information, click the checkbox for Earliest Fill Date to enter when the patient can fill the prescription. The formulary section in the middle of the screen will output any coverage information for the selected medication, including drug alternatives if they exist. Not all insurance carriers transmit this information to ChartMaker, so you may see this blank like we are seeing here. Likewise, you will also see additional insurance information if you click Medication Eligibility. If you need to document consent for your staff to view this patient's medication history, click the Medication History Consent button, select the applicable designation, and then click OK. This is designating consent to view the information in the Medication History button to the right. If there are any forms of this medication that have been taken off the market for any reason, the Inactive Meds button will be available and will display the list once selected. To view the manufacturer's information on this medication, click Medication Info. You could then provide this information to your patient by clicking Print at the bottom. If the patient has more than one payer on file, you will be able to select the correct payer by clicking the corresponding dropdown. This information is provided to us by SureScripts. Next, select the method in which you would like to give this script to the patient, e-prescribe or a written script, and then select an applicable diagnosis if necessary. If you are giving the patient a sample of this medication, click the Sampled checkbox and then enter the lot number and expiration date. Or you can click Administered during visit to designate that you gave them this medication during your office visit today. Once you have filled in the applicable information, click Next to proceed. From the confirmation dialog, confirm the script instructions are correct and then fill in the remaining pharmacy information. If your provider practices in multiple locations, make sure to select the correct location from the dropdown. Then select the applicable pharmacy from the dropdown, or by clicking Manage Patient Pharmacies if you do not see the applicable pharmacy already in the dropdown. If you are attempting to e-prescribe a controlled substance, please keep in mind that you must see the EPCS designation next to the pharmacy name in order to select that pharmacy. Also, you will need to click Ready to Sign, insert your token, type your password, and then you will be ready to send the script. After you have double-checked the accuracy of the script information and selected your pharmacy, click Confirm and Send to finalize the script. The script will then be sent to the pharmacy and you can finish your progress note.